Welcome to our series of Visite this Sunday evening. Actually, I'm always really looking forward to this time. And above all, thank you very much again today for your questions, for your important and valuable emails, which I'm trying to work through, of course. But I don't think I'll be able to cover all of them comprehensively. And yet today, Katerina wrote to me. And thank you very much, Katerina, for this detailed email with a question of a thyroid problem. Katerina already had a hyperthyroidism as a young girl or young woman. And already at the age of 15, she started to live with severe panic attacks. Had great internal and external stress. Back then, she lived and studied in the USA. But had no real health insurance, and of course, maybe at that moment, did not get medical help at all, which she would have needed. But there is also a life behind her with really severe childhood developmental trauma. And she was far away from her family, in a constant conflict of loneliness and letting go and feeling abandoned. That is the basis. The hyperthyroidism has accompanied this patient very much. But then back at home, when she was settled with an improvement in the environment, with acidic clay and with a thyroid or an ointment from Veleda, it could be treated pretty well. Then there was a very terrible event for the little family when the 6-year-old daughter fell ill with a tumour and fell asleep after 9 months. I think that's what all of us really never want to experience in our lives. But during that time, the thyroid problem really exacerbated, and the thyroid gland has grown. The thyroid lobes have enlarged. And also thanks for the photographs, so I could get an idea of this growing, which was very slow before, but now, of course, has increased. That was from 2014 to 2019. You also write to me that you started to change a lot 3 months ago. That means that you have now started to let the gluten out of your life, at least wheat for now. You've drastically reduced dairy products except for cheese. You remove meat and bad fats, all those trans fats, from your menu. You are now taking omega-3s, selenium and zinc, vitamin D and K2, and made the sulfur cure according to Dr. Probst. The pressure is easing. Overall, you noticed also through body-oriented trauma therapy that the severe exacerbation of the thyroid gland, with all the symptoms associated with hyperfunction, due to their hot and cold knots, is declining. Back then, of course, they wanted to operate right away, but it's great that you said no. I want to wait first. And it's great that after changing your diet, which you did very consistently, and also an intestinal rehabilitation, That's the foundation for every path. It's the fundamental prerequisite for every street, that you change and continue on another, that you have already felt what your body is capable of. First of all, that's great. Your question to me now is it even possible that the stroma shrinks again? And may I have other burdens that I do not know about yet? And I would very much like to help you on this path and actually confront you and also the audience with a great fact before. Why do we develop hyperfunction at all? Unfortunately, I cannot now see from your email whether we are talking here of a Graves, so of an autoimmune thyroiditis. This means that the body directs antibodies against the thyroid gland and exacerbates this hyperfunction through the inflammation. Incidentally, 50% of these Graves' diseases can regress again. I don't know at this moment whether we're talking about an autoimmune event or of other causes, and you are right, these causes must now also be dealt with. The body is subject to a huge amount of self-regulation. And we manage this great self-control by having our brain linked with our autonomic, self-regulatory, controlled nervous system. That means we also have the cerebral cortex at the top of our brain. We have the so-called hemispheres, the two large halves of the brain. We have the corpus callosum in the connection. These are all centres that are responsible for ensuring that we can move upright, that we can walk, that everything in our body is coordinated, that we also react appropriately. But in front, behind the forehead, that's actually where the oldest part of our brain sits. And that is our feeling brain. It controls us. It controls all of our breathing. It controls our cardiovascular system. It controls the heart rate, pulse, and blood pressure. It controls the kidney activity, insulin production, how many hormones we need and when. It controls our emotions, our thirst, our hunger. Everything is controlled by this brain. And it is closely connected to the spinal cord. In between there is still the cerebellum, which is responsible for our balance, which we maintain for coordination. But this limbic system, which is like the huge control post in our body that always pays attention that what you want and need right now is also made available to you. Imagine you don't want to take the elevator, but you go to the 6th floor and take the stairs. Then your body has to adapt to it. It has to provide you with the energy. It has to increase the heart rate. Because it is now work and performance. This body must now provide the heart and the muscles to you. This is done by the sympathetic nervous system. That's one side of this autonomic nervous system that is responsible to really provide the force for the situation and for the load that the body needs now. Of course, it has to take the energy away from somewhere else now. But the other side is when I get up there to the 6th floor, within a short time, the so-called resting nerve, the parasympathetic nervous system, becomes more dominant again over the other and regulates the heart rate down. Both are parts of this autonomic nervous system. that help us not to waste energy unnecessarily. Imagine if your heart rate would now power through, but you're invited to dinner up there and have a heart rate that is constantly around 150. Then this fine-tuning would not regulate well. And illness always happens that way. First comes the information. The body has to react to the information. If the information is missing again, the body goes back to its old task pattern. But if the impulse remains, but if the panic persists, but if the fear of loss or being alone remains, but if panic persists, then the signal remains, and the body responds to the signal. So at that moment, the first piece of information turns into a dysregulation. In the meantime, the body is adjusting to the fact that the heartbeat rate, for example, is set higher than the blood pressure is set higher. And after a dysregulation, a malfunction always arises. I want to have this explained to you because in the scope of an overactive thyroid, because the thyroid is an organ, that's the clock in our body, it is the thyroid gland that is responsible for whether a heart rate goes up or down, whether a thyroid has to produce more hormones because the need is there or less. It is the thyroid that adjusts our body temperature for us, which gives us a feeling that we now have to produce more heat because the temperature has to be equalised. It's only 8 degrees outside. The body temperature must always stay above 37 degrees. The thyroid does all of this. And with your development of not just the optical enlargement of this stroma, of this thyroid gland, the thyroid also wants to compensate for a loss, but also this increases in thyroid hormones. Creates an incredible activity of metabolism and heart rate, and that was what you also felt. It got too tight on your neck and you could hardly stand it. The sad event back then with the little one has for sure stirred up again in a drama what may have recovered. And life can never be undone. Life has happened, and the joy as well as the sadness belong to life. As well as death is a part of life. And sometimes that is a giving back to the earth. When a body got so sick, not worth living, and it's a more honest decision that nature now takes. But something was created for you that needs you now. And you are very right. In the context of this development, also disease development, you have created another breeding ground. That, for example, Epstein-Barr viruses, we all know Pfeiffer's glandular fever, infectious mononucleosis, that these viruses, which also have a high, were reactivated here. Viruses are one of the oldest cell components. They are not microorganisms, since there has been life on Earth or mammals or humans. That means these viruses that always live in the cells and can only multiply there have their respective reference. For example, you sometimes have herpes on your lip again and again, or shingles again and again in this place here on the buttocks, or on the left chest wall. But it's different with Epstein-Barr viruses. Epstein-Barr viruses can reactivate again and again. And of course, the thyroid is confronted with inflammation. And that's why it's very important that you look for a Epstein-Barr reactivation, or a persistent activation, or only an Epstein-Barr virus strain, but it is not active. I can give you some advice on that. There are microimmunotherapists trained in Germany as well as in Switzerland, and those are colleagues who actually have the main focus on immunological processes, and therefore also know which diagnostics are now required to answer that question. Microimmunotherapy is then a therapy that trains the immune system to deal with a reactivation of this herpes. This is also a big component in therapy. Not against herpes viruses or against EBV, but rather to design this process in such a way that the body manages to bring these viruses into inactivity. The other thing is that the thyroid is also the place where toxins can be absorbed. And you should too, in this context, examine the heavy metals urgently. Of course, you first have to be diagnosed how your own detox capacity is, and I hope that you no longer have any heavy metals in your mouth, or maybe never had them. But then take that as an opportunity. Maybe do a so-called DMPS test, or actually the connective tissue test, the oligo scan, to get an idea of the extent to which toxic pollution is also present here and has forced this clinical picture. I think you have already done a great job with the therapy. And now, as part of this trauma therapy, also with the distance of this difficult fate for your family, if you slowly come back to manoeuvre this peace into yourself. Back then, you were still very young. Today, you're a mature adult young woman. I think you will succeed little by little to fill the body more and more with information which bring you into a great parasympathetic strength. And by that I mean this is the healing program. This is the regeneration program. At that moment, the body provides all energy available for this process. I'm also a big advocate of the Lycopus, that is the gypsy wort. And the Lycopus is a mother tincture, for example, from the Ceres company. Can actually adjust the whole rhythm of the thyroid gland very well again. But I have also gathered that you have written that these things essentially already have improved. Everything that contains lavender, hops, lemon balm, valerian, passion flower. These are wonderful plants in addition to speedwell and oak bark that continue to also provide very strong support in the glandular functions. That a glandular function reacts appropriately again. There are also a lot of homeopathic remedies. You've already taken advantage of that, like phosphorus and aconite. But then maybe you leave things like that. to a very experienced homeopath. I think if you admit from the psychological point of view that all the panic belongs to the past, that one can handle these vegetative states, that even an over-functioning human can sometimes admit weaknesses, it is good, and you might find your way back to yourself, who you want to be. Which things you have experienced, but in which things you are now also strengthened, have grown. And I actually hope when I see your letter that you will understand your entire condition, and you have already made the first experiences in the first 3 months that with a caring like a Sisyphus work, or like the bird to which you hold out your hand and just hope that it jumps on. Just like you don't know if it's doing that, but when you stick to it, you'll actually learn, living with this stroma in the moment, but quietly watch what the body is doing, how it can slowly recover. And that maybe it had no other option but to react like that, because it was what was for years stuck in your throat with emotions, and you couldn't just swallow it because it wasn't possible. You were alone. And then to accept the things in life too, I believe that has now put you in a position where meanwhile you can hold it really well in your hands and manoeuvre yourself out of this situation very well in the long term without removing the thyroid gland immediately. That is not a good solution, and I think it's great that you made that decision back then. With this in mind, I wish you all a wonderful Sunday evening, and I'm very much looking forward to next Sunday. Goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.